A new report has revealed a significant increase in the number of minors undergoing gender surgeries in the United States. From 2019 to 2023, over 5,700 children received these surgeries. This information comes from a medical watchdog group called Do No Harm. They created a database to track gender-related treatments for minors. Do No Harm's database is based on information from insurance claims. This includes private insurance, Medicaid, and Medicare. However, it does not include data from Kaiser Permanente, self-pay patients, or charity care. This means the actual number of surgeries could be even higher. The report has sparked a lot of discussion about the ethics of performing these procedures on minors. Some people believe it is a form of child abuse, while others argue it is a necessary step for transgender youth to live authentically. The report does not take a position on this debate. Instead, it focuses on providing factual information about the number of surgeries, the costs involved, and the hospitals that perform them. This information is essential for policymakers and the public to make informed decisions about this complex issue. These gender-affirming surgeries come with a hefty price tag. The total charges for these treatments from 2019 to 2023 reached nearly $120 million. This figure only accounts for the costs covered by private insurance, Medicaid, and Medicare. It excludes expenses borne by patients through self-pay or charity care. The financial burden of these procedures is significant. It raises questions about the sources of funding and the potential strain on healthcare systems. While some argue that insurance coverage for these treatments is essential for transgender healthcare access, others express concerns about the long-term economic implications. The debate over funding for gender-affirming surgeries for minors remains contentious. As the number of young people seeking these procedures continues to rise, the financial aspects of their care will likely remain a key concern for policymakers, healthcare providers, and the public alike. The report also highlights the need for transparency regarding the financial aspects of these treatments. Patients, families, and policymakers need access to clear and accurate information about the costs involved. This will enable them to make informed decisions about treatment options and resource allocation. The report also reveals significant geographical disparities in the number of gender surgeries performed on minors. Liberal states tend to have a much higher number of these procedures compared to conservative states. California, for example, had over 2,000 patients who received some form of gender reassignment treatment, including 1,359 surgeries. The total charges in California exceeded $28 million. Massachusetts, New York, Oregon, and Washington also had a high number of surgeries. This suggests that access to these procedures is easier in these states, possibly due to more liberal policies and greater societal acceptance of transgender identities. Some states are even becoming known as sanctuary states for transgender procedures. California, for instance, has taken steps to position itself as a haven for transgender youth seeking these procedures. This difference in approach reflects the ongoing political and cultural debate surrounding transgender rights in the United States. These statistics highlight the complex interplay of political ideology, healthcare access, and social acceptance surrounding the issue of gender surgeries for minors. The report from Do No Harm has ignited passionate responses from both sides of the political spectrum. Conservative politicians and activist groups have intensified their pressure on healthcare providers who perform these procedures on minors. A coalition of doctors even demanded that the American Academy of Pediatrics retract its support for such treatments. Conversely, many individuals who have undergone gender transitions, including those who did so as minors, have become vocal advocates for the importance of these procedures. They emphasize the positive impact these surgeries have had on their lives and mental well-being. One such voice is Chloe Cole, who underwent a double mastectomy at the age of 15. Cole, now a detransitioner, argues that the data presented in the report debunks claims that cases like hers are rare. She believes her experience underscores the need for greater caution and consideration when it comes to performing these irreversible procedures on young people. The report does not attempt to resolve this ongoing debate. Instead, it aims to provide neutral and factual information that can contribute to a more informed and nuanced discussion about gender surgeries for minors.